My biggest saying is that there are two types of people. People who clench and grind and people in denial.
They forget about their teeth. Everyone in cosmetics, I guess, we're just creating optical illusions. So welcome back to the Unfiltered Confessional. Today I am in Brickell, Miami with none other Dr. Jaskiel, also known as the Brickell dentist. I'm so honored. I'm so excited. Thank you so much for making time.
No, thank you so much for having me. I'm very excited about this. Yeah.
And we're going over a lot today. We're going over how you are a cosmetic, holistic, biologic, biomimetic dentist, and getting into the real truth about how your teeth can affect your face, confidence, and overall health. Dentistry is not just about teeth anymore. It connects the face, the body, inflammation, confidence, and even aesthetics. And when I called you, I said when somebody is trying to do a transformation and look more beautiful or look more attractive, they go and get fillers done, but they forget about their teeth.
Right.
So I'm here to tell everyone, start with your teeth at the Brickell dentist.
Right. It makes a huge difference for sure.
Yeah. How did you get into this, into holistic dentistry?
So it was crazy because when I was younger and on my first year of dental school, I actually found out that I have Crohn's disease. And that was a huge factor for me because it's something that sort of eats away at your own body, and it really affected my entire life. I had physicians for many years who were telling me that I have to take medications for the rest of my life, and some of them would give me very heavy medications and with a lot of side effects. I really wanted to try to find natural approaches and different ways of doing it, different diets and different, understanding of what the source of this problem was. And it's very, very difficult to find out that really there is no particular source that anybody knows about. So when I look at dentistry, I always think of how can I help my patients in a different way. I want to actually find the source of the problem, try to treat that, and then see if I could help those patients in a different way.
Yeah, and we can see that. I see a lot of patients that you post, and I'm sure a lot that don't allow you to post.
Right.
And you can really see that you're putting the patient's health first. Yeah. And the results are beautiful. What is the biggest thing that people misunderstand about dentistry? Veneers, root canals, mercury fillings.
So for one thing, dentistry is going many different ways. You have dentists who actually just deal with the actual teeth themselves, and they'll do fillings and crowns and root canals, and really they're not really talking to the patient of how, like I said, the source of the problem and how they got to that point. Then you have other dentists, sometimes on a holistic, they'll actually say, okay, you have root canals, let's take out those teeth. Not understanding that maybe sometimes we have to really be proactive about these situations and try to prevent those root canals to begin with. I don't really see people talking about that as much as they should. So to me, creating a balance of a little bit of everything is important. It's not just about going one extreme or another extreme. It's really sort of getting everything together and trying to help those patients.
Biomimetic dentistry, what is that?
So biomimetic dentistry is actually not necessarily a new concept, but it's something that's been gaining popularity over the last several years. But it's really about doing reducing less tooth structure, and also mimicking natural teeth structure as well. So you could do biomimetics in cosmetics, you could do it in just fillings, you could do it in crowns, or doing less of a crown or trying to do an overlay. But basically it's about reducing less tooth structure and using more bonding techniques. And to me, and since I've been doing it over the last several years, I've noticed a huge decrease in the amount of root canals that I need to do. Matter of fact, it's, we took the statistic back in one of these past years, and we took all of the different restorations that I've done and put that against all the possible root canals that these patients needed, and it was 0.0044%, which is very, very, very low. And that's almost unheard of in dentistry. And that has to do with also taking time and really building things up in a way that, just removing the decay carefully and trying to arrest the decay, making it that it doesn't really return. And also building the tooth up with different layers, and those layers actually protect the teeth and seal the dent in it. So it's a very cool concept that I'm very proud of, and I'm more proud of that sometimes than all the cosmetic cases that I've ever done. There's a couple of few cool cases that I did recently. One of them was, again, trying to, let's say this patient, we had to build up their bite a little bit, but instead of using crowns, we're using sort of like almost like an overlay that just goes on top of the tooth. So we're basically not even reducing the tooth. We're pretty much just preparing it a little bit so that it has a good seating situation. And then we bond this like sort of little piece, an overlay on top of the tooth, which is actually really, it's not reducing tooth structure at all, which is a very cool biomimetic approach. So that's one case that we just finished, and that's really nice. One case that we just finished not too long ago, which I'm very proud of, is a patient that we had a complete reconstruction with him. He had a lot of decay for whatever different reasons, and he was told by a couple of dentists before he saw me that he would need multiple extractions and a lot of root canals, maybe even up to 10 root canals and extractions. I was able to do his entire case without a single extraction and not a single root canal, and the pictures on that is unbelievable. But it's one of my very proud cases because it's not all about just cosmetics. Yes, he looks beautiful and it's amazing before and after pictures, but really by looking at him and saying, okay, he has no pain and he has so much decay, and he really, if you look at the x-rays, almost every dentist would have said, oh yeah, it probably would have needed a root canal potentially, and I was able to do it without that, and he's still doing very well, and that's something that makes me very proud.
Wow.
Yeah.
Is that part of the Jaskiel technique or no?
So Jaskiel technique is a little bit of everything, but really I think the biggest thing with the Jaskiel technique is that I'm trying to understand the patient's psychology more than anything. I want patients to, because a lot of people have trauma when it comes to dentistry. You come in with when you're young, and the first thing that, even the parents say is sometimes, this is not going to hurt, don't worry about it. That's a negative connotation, and the kids are not stupid. They understand that, why is my mother saying it's not going to hurt? There must be something that could hurt here. So you have to go with a positive vibe. But that trauma from kids actually comes to adults, and that follows them through their entire life. And sometimes they don't even understand why they're afraid of dentists. So to me, it's sort of like building blocks to help patients really go to a point where they're going from really fearing a dentist to being very, very comfortable coming to a dentist. And that's something that I've worked with many patients to do very successfully. To the point where they were able to do a lot of all their work that they really needed and feel good about coming in, and that takes time and that takes a lot of effort, and that's on both parts. But it's really more about doing small things sometimes first, and then going to the more complicated parts of so they understand that this is not so bad. Using different types of injection techniques, try to make them feel more comfortable. Also, like I said, showing them everything that I do, pictures before, during, after, building a trust. That trust is everything to everyone. And when it comes to any medical procedure, and again, I'm talking from first-hand experience. I've went through major medical procedures, surgeries, and I know that it was hard for me because sometimes you don't know what's going on, and I know what's going on, so I can't imagine if somebody who's not in the medical field understands that. To me, I wanted to be that person that's not going to be like everyone else. I want to have full transparency, full trust for the patient, and make patients feel like they shouldn't have to worry about coming to me and not worry about the outcome and the materials and everything. It's all about the psychology, honestly, yeah. So people come in with different fears, and I try to take the elephant out of the room for patients and try to really talk about things, because the more you talk about something, just like if someone's sitting on a psychology couch, for someone, you want to bring everything out, and then maybe they'll feel a little bit more comfortable about it. So usually it could be mostly, let's say, about fear of pain, right? Then you have the financial aspect, and then you can have the anxiety of it. Okay, just overall anxiety, and sometimes people just can't pinpoint it. It could be even noise that they're fearful about. And sometimes it's just about time. They just don't have the time. So we try to figure out what their issue is and then try to see if we could work on that and eliminate that for them. And that usually helps them try to move forward and be able to get things that they need to get done or have not gotten done for many years.
Mm-hmm. How can disrupting the oral microbiome affect the mouth and even the body?
Right. So again, most people think the mouth and the body, two different things. People don't understand. They almost feel like a dentist is like a mechanic in a way. Okay, they don't see a connection, and it couldn't be further from the truth. I had a patient who had just really bad oral hygiene, and a lot of bacteria would build up, and he ended up having open heart surgery. He had no other medical problems. He was fairly young. There are many studies that actually link, the heart, diabetes, Alzheimer's, you name it, pretty much anything, even ulcers. Ulcers come from something called H. pylori sometimes. A lot of times it's bacteria, and sometimes it could be regular ulcer. But either way, all of them stem from the mouth. It actually starts here, and then it moves down. The microbiome is huge. And again, when somebody has Crohn's, colitis, anything that has to do with their intestines, where do you think it comes from? Okay, it doesn't come out of nowhere. It has to come from somewhere. It comes from foods. It comes from bacteria in the mouth that's sitting there, cultivating, growing, and constantly just getting into the bloodstream. So those are the type of things that people don't understand, and understanding how to control that and basically disrupt that bacteria. And the way to disrupt that is one of the things that I'm constantly working on. Now, some people, just go to the dentist and they say, oh, I'm bleeding, or they don't even tell them they're bleeding. They think it's normal to bleed. But if somebody's bleeding, that's an infection. It's as normal to bleed in your mouth as it is to bleed on your foot taking a shower. There's no difference, basically. And it's actually even worse because here you're actually having this bacteria get into your bloodstream 24 hours a day, 7 days a week, and your body's constantly fighting it. The cells in your body are constantly going into the mouth and really trying to get this under control. And people don't understand that. And everything's about inflammation. So if you have an inflammatory reaction within your mouth, your CRP levels are going to be going up, your other inflammatory markers. That's what, like a lot of different issues that patients have in their body are dealing with, all inflammation. So by lowering the inflammation in the mouth, your cells in your body can actually work on other parts of your body and help that, as opposed to sitting there and constantly fighting many different fights within your body. Okay? So that's another thing that I keep in mind and try to help patients overcome.
Mm-hmm. Yeah, we're constantly, even with my wisdom teeth, I remember when I used to have problems with them, I would just keep getting Paradex, and if that didn't work, antibiotics all the time.
Right. So
now I don't have issues with my wisdom teeth, and they're still in, but...
So the Paradex, did you know what was in the Paradex, which is chlorhexidine glutamate, right? A lot of physicians use it before surgery because it actually creates, an antiseptic area. The problem is that when it comes to teeth, we don't really use, Paradex or chlorhexidine much anymore. Again, I want to make sure that I'm talking about the right thing, Paradex. Yes. But it actually has some issues allowing the periodontal ligament to reattach, so we try not to use it. It's really more of an old school technique. These days we're using a little bit more of a holistic ways of doing that. Even regular periodontists and general dentists are trying to mostly steer clear of it. It does stain your teeth as well. I don't know if you noticed that when you were using it. I don't know if you're using it for a very long time or if it was just short time.
The pharmacist told me not to use it as a regular mouthwash.
Right.
She was really strict with that.
Right, so that's probably why, because there's two, like I said, if you're using it for a longer period of time. If you do, let's say, an irrigation in a specific area, just to disrupt the bacteria, that's fine. But using it on a regular basis, especially after surgery, it's not warranted. Or if it's, just to get, rid of some bacteria a little bit, that's fine. But we're trying not to use those things as much anymore.
Yep. Yeah. Why do you think dentists are prescribing so many antibiotics all the time?
So that's a great question, and it's a pet peeve of mine a little bit, and I very much try very hard not to do that. What they're doing is they're trying to control infection, and I understand that. And if somebody has a massive infection in their mouth, if they're planning on doing something about that infection and treating it, then of course maybe it actually makes sense to potentially use an antibiotic as an adjunct to try to overwhelm that bacteria and try to get rid of it. Obviously, you want to clean it and using ozone and doing different types of disinfectants while we're doing the procedures. But when it goes through your body and goes through your liver and literally kills every good and bad bacteria within your body, that's not a good thing. And that's what sometimes, and we don't know what causes Crohn's, we don't know what causes colitis, and we don't know what causes irritable bowel syndrome. Those things could be because you're disrupting the bacteria within your body and using too many antibiotics. It definitely disrupts the bacteria and the microbiome of the gut and the mouth, and I don't want that to happen for patients. So what I try to do is use things that are much more localized, and I know that are tested and proven that are not going to affect the overall microbiome and flora of the gut or the mouth. Okay, so that's very, very important. I'm constantly talking about that to patients, and whatever it is, it's worth worth it to try to be different and try. And I'm actually very, very successful doing that, especially when it comes to periodontal disease. The way I've done things, over the last several years have been all about results, and I definitely get results with that.
What do you do instead? Can you share?
So it's basically, we're trying to, number one is get rid of the bacteria. Okay, so that has to be done manually. It's not like you can do something like in a leg, you get an infection, you can take an antibiotic, you could put a cream, whatever it is, and then the cells from your body overwhelm that area and actually can control that and actually can get rid of it completely, as long as you actually do it for enough time. But again, that's going through your entire body in order to get to that one spot. Okay, in the mouth, it's very different. So we're trying to, number one, get rid of the bacteria, but number two is, like I said, disrupt that bad bacteria that's within those areas. So trying to use different, like natural, like I said, ozone going through that area, and other localized, potentially, antibiotics. Now, the localized antibiotics, I'm using less than 1 milligram, as opposed to, let's say, if somebody takes an antibiotic by mouth, we're talking about 100 milligrams, 500 milligrams, 875 milligrams per pill times 7 or 10 days. All that to just get to this area. So that doesn't make sense to me. And again, if I didn't get a result by doing all that, then I can understand, okay, if I'm not getting the result, we have to move to a different approach. Even possibility of bacterial testing, seeing what kind of bacteria is in the patient's mouth, and then overwhelming that bacteria in different ways. Even if we have to sort of use, some type of probiotics. Thank you, sorry. So if we want to use, maybe sometimes we have to use probiotics, and if we can, now that's if I don't get results with the way I normally do things. But thank God, for the most part, almost 100% of the time I get results, unless the patient has overwhelming missing bone to the point where it's like 8, 9, 10 millimeter pockets, and those things are sort of unfortunately doomed from the beginning, and there's really no way to really sort of reverse that. But if it's in the realm of something that can be reversed, and I could do it the way I do it, usually I get very nice results and lower the inflammation very quickly.
Nice.
Yeah.
In terms of toothpaste, do you use regular toothpaste, or does it have to be natural?
So it's very interesting that you're asking that, because I actually worked on my own toothpaste for 2 years, and I actually started giving it to my patients here recently. So I'm not somebody who shies away from regular toothpaste. There are many dentists who practice the way I practice who say, okay, no fluoride whatsoever. But I also recognize, and even for myself, I try to lower the fluoride content potentially. Now, there's a difference between fluoride in the water, which is a medical grade fluoride, as opposed to fluoride in a toothpaste, which is more of a topical fluoride. Okay, so now the point of fluoride is to actually kill the bacteria. Okay, so that's what we're trying to do. Many patients are using nano-hydroxyapatite. Now, hydroxyapatite is something that your teeth are made of, so if you have a nano form, which is smaller, so it's actually going to help remineralize those teeth. The problem with that is it's not anti-cavity, it's actually remineralizing, so it sort of blocks the actual food or bacteria from going on, but it's not going to kill the bacteria. So I actually came up with a formulation that has two components that remineralize your teeth, one component that actually kills the bacteria, and some other emulsifiers, and like coconut oil and some organic mint, but for flavor. But the overall concept of why I did this is because I saw patients getting cavities by using just nanohydroxyapatite, and I saw that I felt like there was something missing that people were not doing, and if they're not using fluoride, I have to come up with something. So I actually did that, and now I'm actually just having it for my patients, so it's not something that I'm doing for the general public yet, but patients are loving it. They're actually showing less sensitivity, and if somebody is okay with fluoride, they can add a little bit of regular toothpaste to it, and it'll actually take some of that fluoride and grab it with some of the things that I have to remineralize, and then reincorporate onto the teeth, and actually have two things that kill bacteria and two things that actually remineralize, so it works very well. But again, there are toothpastes out there that actually can work well, and I have patients sort of mix and match. I don't believe in like one toothpaste the entire day. I usually tell patients to mix it up with the different types of toothpaste.
It's interesting. I didn't know. Congratulations.
Yes, thank you.
That's so cool. Even you created toothpaste.
Yeah, I actually have to give you one. Rena, well, let's get her one.
I would love it.
Of course. There are different types of mouthwash, and a lot of mouthwashes have an alcohol content, so that sometimes could dry out your mouth. There's a little bit of controversy when it comes to different types of mouthwash. People think that by using mouthwash, you're killing all of the microbiome within your mouth, good and bad bacteria, so they don't really want to use it on a regular basis. Is there truth to that? Yes and no, and I've tested it, and I've actually, because we have a microscope, we actually, check our patients' bacteria and show them, how mobile it is, or the types of bacteria sometimes. And it's more for like sort of education, so that they understand that what we are seeing is bacteria, as opposed to thinking that it's just food. So that's a huge thing. But really, what we did was we actually had patients rinse, and then we check to see if they still have certain types of bacteria, and we see that they still do. So it's not exactly so perfect about people thinking that this using a mouthwash isn't all bad, but in the same time, using certain types of mouthwash could actually, like I said, cause drying, and drying of mouth is not great because that'll increase bacteria within a short amount of time. So anything that causes dry mouth is not necessarily a good thing, and we can talk about breathing and air. I mean, that's a whole another realm, and we can go on and on to that.
We still have sleep apnea to cover after.
Right. Exactly.
So mercury fillings are huge online right now.
Right.
Are they actually dangerous, or is it dangerous during the removal? And what is the proper way to remove them?
So again, I personally, there are many dentists, within the holistic realm that see a mercury filling and automatically remove it. I don't always do that, which is different, but it 100% has to be removed in a safe way, okay? Because if you're going to take out a mercury filling, it's going to get into the air that the patient's going to swallow, breathe it, and it's not a good thing. So 100% it has to be removed with a smart technique, which is actually where we isolate the area, use very special suctions outside the mouth, inside the mouth, really block everything out for the patient, and that I'm a very big believer in. As opposed to removing them, it is very difficult to see when somebody has a cavity in a mercury filling. It's the seepage. Just a small amount of seepage can create a cavity, and almost every single time, I would say 99.9% of the time when I remove these fillings, unless it was done obviously recently, I'm talking about, because mercury fillings are being used less and less by most dentists. It has been outlawed in certain countries, actually. Even within the water lines, we have to be careful, and that's ironic to me, because the actual city or the governments care about the water lines, but they don't necessarily care about the dentists putting mercury in the mouth. So that just sort of doesn't make sense to me. But again, I'm going to leave that to the ADA and let them talk about that. Yeah. But to me, I just want to be safe for my patients and make sure that number one, I haven't put one in since dental school. Number two is when I see something that's seeping, I want to make sure that, because when you have a mercury filling that's seeping and there's dark around it, that is actually causing a leaching effect, and that could be causing a leaching effect of the actual mercury, and there is such a thing as mercury toxicity, and that's something that we want to be staying a step ahead of, okay? And then also preventing them from having issues after. But removal is definitely very, very important to be done very safely.
The biggest lie people believe about veneers and smile makeovers. Do veneers actually ruin your teeth, or does it depend on the technique and how aggressive the preparation is?
So this is a loaded question. I'm going to have to take a drink for that. It's a hot topic, obviously, especially here in Miami, where everybody wants veneers. And ironically, I actually sometimes talk a lot of patients out of veneers. I've actually had at least maybe 2 or 3 housewives in Miami that I've seen that I've told them do not do veneers. I literally was like, you do not need veneers. You have beautiful teeth. And they're like, because they're looking at patients and they're trying to see, people out there, and like people have super white teeth, so their perception of what looks good is different to them. They think that looks great. And a lot of people are going more towards a natural approach, and some people are not. But either way, once you have veneers for life. I want to make sure that people understand that, okay? And it's something that you should obviously think about. And if you do it, you have to do it well, okay? Many of my patients, if not literally my last 4 cases, okay, were all redos from other dentists who had open margins where bacteria was getting underneath and causing major issues. And it can cause decay, it can cause periodontal disease, it causes massive buildup, and bleeding, inflammation, just all of these things that come from veneers that were done poorly. Now, it's funny because I have patients who are very well known and who have beautiful teeth, but they do veneers and they think it looks great, but the underlying problems underneath are most likely going to end up with them losing some teeth. And there's also different types of veneers. There's stronger veneers and weaker veneers. How do you get a balance that something is going to be very strong and look good? So that's a whole topic on its own. Okay, so we can go into each one of those if you want.
Let's do it. Let's go into each. And also, when we do veneers, do we always have to shave them down to those triangle scary?
Right. So the answer is no. And I really, really work very, very hard to try to be minimal prep to no prep as much as possible. Now, generally, if you want, you need to have a good seamless margin. So this is the biggest problem, like I was saying earlier, about patients who go to many dentists who are cheaper because they do it very quickly. They do labs that are very fast, and they want to knock them out, and they're doing 2-3 cases a day. And at the end of the day, what happens is that the margin where the tooth meets the actual veneer is open and a little bit, not in line. It has to be seamless because you want the gums to be healthy, okay? And you want bacteria not to be able to get underneath that veneer so it doesn't destroy the remaining tooth structure. Imagine, most dentists say, let's say veneers last 10, 15, 20 years, let's say, right? You're living a lifetime. Somebody's doing it at 25 years old. You're going to get veneers several times. You want to have teeth underneath of there to actually do veneers. And veneers really need to be done, or should be done, on top of enamel. That's the best bond. Otherwise, you're going to have veneers that are popping off. So imagine going to a restaurant and then all of a sudden your veneer pops off because they over-reduced the tooth. You don't want that.
No, we don't.
The bonding technique, when I do it, I spend sometimes 6 hours, 7 hours just cementing the veneers on. Yes, that's a long time. And many dentists who are doing things of the way I'm doing of that caliber will take much quicker to do it. But I want those veneers to be set on there perfectly. And if I have to do 2 at a time, then that's what I'm going to do. If I do sometimes, and I've seen dentists who will do it from one side of the mouth to the other side, and then I see the work afterwards, and I see them lift it a little bit, and I see holes and spaces. It's like, doing a tile on your floor, and then knocking on the tile, and you feel it's hollow, and then you have something that falls down onto that tile. What happens? It cracks. So you really need that veneer to be 100% against the tooth and really be bonded very, very well. Okay. Also, again, the type of material. There's something that's very well known now. A lot of people are doing it. It's called feldspathic veneers. What is a feldspathic veneer? It sounds really cool because you're basically taking a powder liquid and you're building up a tooth and you're making it really nice, and it has a beautiful, like a very nice see-through, translucent look, so it looks very natural. The problem is that they chip very often. Okay, why? Because they actually can handle a certain amount of megapascals of strength, and that is about 90 to 100 megapascals of strength. Okay, while an Emax veneer, which is called a pressed ceramic or something to that caliber, can handle about 400 to 450 megapascals of strength. Now, if you combine the two together, it means that you have, let's say, a pressed ceramic and then you layer it on top, then you can get the nice, beautiful, natural result, but have the strength and the beauty in the same time. So that's sort of what I usually try to do for my patients, to give them both. But it takes more of a technique. The labs have to be better. We have to spend a lot more time with, knowing how much or little reduction to do. We want to do the minimal prep and still be able to do those type of veneers. So that takes the challenge, and that requires a lot more.
Wow, that sounds very timely.
So I do a lot of preparation before I do every case. I really, really spend most of my time to try to make sure that, number one, I'm getting a natural result for the patient. The biggest compliment that I want my patients to get, and they do get every single time, is that you look great. What did you do? Not that you look great. I see you did your teeth. Okay,
Yeah.
and that's a big problem, because most people don't even want to get veneers because they think that everyone has veneers because they see them and they know that they have them.
Yeah.
When patients come to me, I have them go into the hallway here around my office, and I have them stop people and say, "Hey, how do you like their teeth?" And they always say, "Oh, they look beautiful. Did they whiten them?" Literally, that happened 3 times in the last few cases.
Wow.
Not that, and these are true stories. I'm not making this up. It's literally exactly what happened. And that's a huge compliment. I had 2 patients that their own mother didn't know they had veneers done. Okay, so they were talking to their mother, and they like, "Oh, you look great," but they didn't even know they had veneers done.
That's amazing.
So
then why do some veneers, I know you were saying some of them have the gaps, but why did some of them look so bulky and fake?
So a lot of it has to do, again, with pre-planning. So if a lot of dentists will jump in straight into veneers without really pre-planning the case very well. So by me, even with my labs now, like sometimes I have to train the labs. Don't just be additive. Do what's best for the patient to look as good as they can. And the only way they can look natural is if it actually fits their face. Mm-hmm. When you see a picture of somebody's teeth right here, it could look amazing. As a matter of fact, again, I had a patient recently. I actually was testing a lab, so I had 2 different labs create the veneers. Mm-hmm. When I had it on the model, it looked amazing. It looked unbelievable. And then even when I put it into the mouth and I took a picture over here, it looked great. But when you looked at the whole face, it looked long and bulky, and it was terrible. I had another set, it wasn't, I had them simultaneously made, so the second set was seamless, beautiful, and fit the patient's face perfectly. So just because something looks good like this doesn't mean it's going to look good, overall with their face. Mm-hmm. But another thing that I noticed is that most labs and dentists are making their teeth look a little too long, mm-hmm. and that also makes things a little bit bulky as well. So again, there's several reasons why it's looking bulky, but really it has to be pre-planned well in order to actually not get that bulky look, and I spend a lot of time with that.
Yeah, I can tell. The results are beautiful.
Yeah, thank you.
As an injector, not in Miami, only in Toronto.
Okay.
I look at lips and chin, jawline, teeth, facial balance all together. From your perspective, how much do the teeth, bite, and jaw affect the face, lips, youthfulness, and overall facial harmony? Okay. You're going to say 100%?
Well, 100%, yeah, for sure. I mean, lips are a huge thing when it comes in harmony of teeth. I'm constantly looking at patients' lips because, number one, is many patients have one lip lower than the other lip.
Yes.
Okay? And I always need to try to figure out how to create an illusion for the teeth to look more balanced. And if you look at almost every one of my before and afters, you see that somebody has one lip lower than the other. Mm-hmm. So If somebody's doing injections already, then I always tell them, okay, definitely have them put a little Botox on one side and drop the lip in a certain area and try to create and continue that harmony potentially. At the same time, I need to actually sort of, throw out the possibility that if they don't do it anymore, I don't want my teeth to look bad, so I have to sort of create that illusion and broaden out certain areas to make it look better. Mm-hmm. But chin, lips, face, all of that needs to work in conjunction together. The mouth and the smile is obviously, to me, number one, obviously, and I think that makes the biggest difference. But then on top of that, all of that, that youthfulness and, everything that comes with it can make a massive, difference overall.
With the, so yes, for lips, actually, before I do lip filler, if I see a bumpy lip, yeah. I always flip the lip and I see, because for me, like, I have a little ridge here from before braces.
Right.
Everybody has, and it was a little bit protruding, that tooth. So everybody has the asymmetry on the lips. So right. I feel like if people went to the dentist earlier
yeah.
and got it all fixed and then came to me, it would be easier.
Right, of course.
100%. And if someone fixed their jaw, they wouldn't have to necessarily get chin filler or jaw filler. Sometimes, what is it called?
Retrognathic jaw, right. So that has to do with airway and breathing also, because if you have less expansion of your arch, sometimes you can have problems breathing. Mouth breathing also at night, there's problems with that. Clenching, grinding, open mouth versus, that's a whole nother topic that has to do with myofunctional therapy, speech therapy, tongue position. All of that has a lot to do with each other. And again, that's a whole nother, realm and topic.
Yeah.
But for sure, what you're saying is very valid. And one thing I've noticed is that the people's teeth tend to be more in on one side, which also obviously makes their overall facial appearance different too. So that's another illusion, and sort of broadening the buccal corridors, constantly, and trying to, get all of that harmony is really important when I do these cases, for sure.
Everyone in cosmetics, I guess, we're just creating optical illusions.
Right, constantly trying to stay ahead of something. Even one tooth, if it's out of proportion, it could sort of throw off the whole balance of that one side, and it can actually create an illusion of the lip coming in a certain direction as well. So, again, that's why I also work closely with some very good, injectors in the area who are excellent and have great knowledge of the face, and I want them to have knowledge of facial skin as well as, more than just Botox and dermal fillers, but a little bit of everything. So this way they can really stay a step ahead of it and enhance what I actually do, for sure.
Yeah. Why do you think people are clenching so much now, and what signs should people look out for before they go and get Botox, and when they need Botox versus when they don't for TMJ and clenching?
I love this question, and I think about this a lot because, and we just had this conversation with the patient that literally just walked out of here. And people travel constantly, and people equate stress to negative stress. Okay, that's what everyone thinks. I had a bad day, I have a bad job, I have a bad boss, so there's all negativity. And then I'm clenching because of that. Yes, that's true, but really, people clench more for positive stress than they do for negative stress. Getting a new job, flying to a vacation, buying a new house, getting a new car, getting married, getting engaged. All of these things are great and unbelievable in your life, but really those things actually create a stress. And that stress actually turns into clenching because you don't realize it's a stress. And that's where people have bigger problems than they have with the negative stress a lot of times. People who travel a lot are constantly clenching, constantly. And my biggest saying is that there are two types of people. There are people who clench and grind, and people in denial. So that's pretty much everybody, okay? As opposed to, now when it comes to Botox, that's a great question about Botox, about whether or not Botox is the right thing to do. So for first line of defense, I always say, let's try night guards. And there are many different types of night guards out there, and I try to be sort of like Costco and bring it down to one or two things. And usually it works very well, but there are options. And it has to do a lot to do with whether they have symptoms or not, or whether we just see it. But sometimes, Botox can actually be a good thing for acute situations, where it means like you're having a problem now. But there are some studies that actually show that the bone density actually can come down by using Botox for a prolonged period of time, for a very, very long time. So, and I actually just saw that study recently.
Okay.
So you have to sort of be careful about putting somebody on Botox for very long periods of time. But if it's short amounts of time, then it's fine. But for a longer amounts of time, I would say definitely try to find more of a holistic, natural approach. And a lot of times that has to do with certain types of night guards and certain, and I have a whole protocol that we go through for patients. As far as exercises and lowering inflammation and different ways of doing that.
Interesting. Yeah, teeth clenching and grinding is big.
Yes.
And do you see the effects on the teeth when people grind their teeth?
Yes. So I would say, first of all, most people, I would say 95% of people just clench and they don't necessarily grind. But yes, I definitely see some effects on their teeth, and I can almost tell immediately that somebody's clenching by looking in their mouth for sure. Yeah.
Okay.
Yeah.
I feel guilty right now. I'm like, don't look. Okay, so what changes in the mouth should never be ignored, whether it is jaw pain, bleeding gums, snoring, grinding, bad breath, oral cancer signs, or sleep apnea symptoms? Huge question.
Huge question, yeah. So first of all, a lot of those things are interconnected. Multifactorial is huge in overall in dentistry, as a whole. I mean, it's rare that I'll find one thing that has nothing to do with something else. And that's like, again, to me, the holistic approach. Holistic doesn't necessarily mean alternative. It means, again, trying to figure out what one leads to the other and how that can be affecting something else and how we can take care of that thing that hopefully will help the health of that patient overall, okay? But either way, when it comes to the, we were talking about the
sleep apnea.
The sleep apnea, right?
Yeah.
So jaw, let's say narrow jaws, okay? That's a huge thing, okay? So that, it has to do with the airway. Patients who snore have a lot to do with the airway. Patients, and all of that interconnects to sometimes mouth breathing, and mouth breathing lowers the saliva. And then saliva lowering means that you're increasing bacteria, and that increases decay and increases periodontal disease. So all of that things have to do with health overall, because if you're increasing periodontal disease, now that person's more prone to potentially heart attacks or strokes, or like I said, diabetes, rheumatoid arthritis, certain cancers, okay? So all of that is interconnected. So it's really important to sort of look at the patient and spend time diagnosing the patients, to look at as much as you can and have a continuity of care. If you're jumping from place to place, if you're living one place, you're living somewhere else, you're seeing a dentist here, seeing a dentist there, you're not really getting a patient to get to know you and really understand you. Sometimes it takes me years to really get to the point where I know, okay, this is the issue. Because we just see changes over the patient, and sometimes it's happening because certain things in their life are happening. I actually had a patient recently who had something in their mouth, and it was going well for many, many years, probably at least 15 to 17 years, I would say. And then one day I look at their x-rays and I see an infection, and I'm like, something's going on. Is your health okay? Are you feeling well? And they go, it's funny you asked. I was deathly ill for like 2 months. I was in the hospital. There was so many issues that I was having. He's like, how could you tell? I was like, because I saw this issue. I know that it was been under control, and then I see that it's not. So it looks like your immunity has been suffering. So obviously, to me, that means that something has changed in your life, and that's what prompted me to see that. And then we had to address the problem.
You see everything.
I see more than people think. Like, there's a lot of things, especially sometimes what you eat, what you drink. Certain types of foods I can tell that you eat more of, and certain foods that you don't. Drinks, a lot of things that, lifestyles, changes basically. But yeah, a lot of things can be told by looking in the mouth. So
to confirm, smoking and alcohol is very bad for your mouth 100%. Microbiome.
Yes, for sure, because the way it's doing it is it's, again, lowering the saliva. That's number one. It's cauterizing the blood vessels, so you don't really get the same symptoms as somebody else who doesn't smoke. So number one, so you're having a problem that's increasing bacteria, but you have no symptom to actually tell you that. And that's a lot of dentistry overall. People don't have symptoms. So people think, I'm doing fine. I have zero symptoms. Why are you telling me I have this issue? but really they have an underlying problem, and unless they address it, they're not just going to lose their teeth, but they can have multiple issues throughout their body, and they don't realize that. So really trying to be proactive about your overall body is very, very important. You don't go to a physician after you have a heart attack and say, okay, now let's control my blood pressure. You really need to check your blood pressure in advance and really see how this hopefully can lead to something and address it. Exercise, all those things. Same thing with the dentist. You really need to be one step ahead of that and try to be proactive about it.
How often should someone see the dentist?
So for exams, I would say twice a year. It's fine. For cleanings, I would say most people have some type of issue. They should be doing their cleanings probably every 3 to 4 months for sure.
Okay.
Yeah, 100%.
Now we're moving on to our quick myth-busting round.
Okay.
So I will say a statement and you will tell me true or false or it depends.
Okay.
There's 10 statements. If your teeth do not hurt, your mouth is healthy.
False.
Bleeding gums are normal.
False. You can never be bleeding at all in your mouth. If you're bleeding in your mouth in any way, shape, or form, then you have a problem, and that needs to be addressed. There's no such thing as normal to bleeding gums. That's it.
Veneers ruin your teeth.
False.
Okay. Mercury fillings should always be removed.
I would say that's false, in my opinion.
Yep, after what we've discussed.
Right.
Root canals are toxic.
Root canals are toxic is a very controversial subject, but they need to be watched carefully. Very often root canals could fail, and really you need to know that. And that's why one of the biggest things I do is try to prevent root canals to begin with. And I spend a huge amount of time doing that. If I can give somebody several years without a root canal, then that's a win. Okay? So the answer is, if root canals are not done very, very well, then they could fail, okay? And that would be toxic, and that is an agreeable statement. But if it's done well, I can show you many, many cases where the patient had infections and then it went away, okay, after doing it. But it has to be done very well, and it's very difficult. I did studies on root canals for many years. I have one here that you can show your people that is... It shows the intricate details of an actual root canal. Sometimes it's impossible to really clean a root canal 100%. And that is the reason why some dentists are saying take out all root canals. And I actually agree with that a lot of times, because you have dentists who are doing root canals very quickly, getting them out of pain initially, but then the infection is still remaining, and that is a problem because your body is actually constantly fighting that infection. So if that's the case, yeah, definitely take those teeth out and make sure that you're eliminating the source of the infection and getting rid of it. If it's a tooth that actually you can control, and not, there are some dentists who will say, oh, that's impossible, but the amount of dentists that say that is very, very small. And I think that that overall we can control some teeth, but like I said, it has to be done very well.
Got it. All right. Invisalign can change your face.
Absolutely. I have many cases that it does, for sure.
Botox fixes TMJ.
False.
Yeah. It can fix the masseter.
Right.
But it can't fix the actual TMJ.
Right. So that's the biggest misconception also about TMJ in general. Really, again, very high, 90-something% of people who have TMJ issues are really muscular. Okay, so it has to do with temporalis and the masseter muscles here. So if you have a true TMJ problem, that's really the actual joint, okay? And that's more rare. And that happens if somebody doesn't address it early enough. And that's, again, why we tell patients, don't wait for a symptom. If we see something that's going on in your mouth and it's actually something that we can know that you're clenching, let's try to make a night guard. A night guard has to be done well as well. It should be mounted properly. It should be custom made. Patients who do it, by mail order things, and we always see issues. They have separation of teeth. Their bite is actually realigned in a bad way. So it has to be done properly, and it has to be done with very good labs. Many times I'll do night guards, and I'll have to send it back and forth to my lab because it's not done well, even with my labs.
Wow.
A lot of dentists also say, oh, you could wear a retainer for a night guard. That's a whole other topic. It's not really, a retainer is not a night guard. There's two different purposes for it. A retainer retains the position and goes over the entire tooth, and it's very thin. A night guard actually brings the tooth the teeth up and actually makes a bigger difference because it allows your jaw to move freely. So it allows your something called centric relation position to be more free, so your jaw can move where it likes to be, not as opposed to where your teeth want to be. Okay?
Interesting.
So, and that discrepancy, it has a lot to do with why some people actually clench and grind. So knowing how to recognize that and also having the right type of night guard that's actually going to make a difference for that is a big deal. And even in dental schools, my kids who went to dental school, they actually told them, just take an impression of the upper and you can give them a night guard. And that's like, that didn't make sense to me. So I'm like, even the labs told me, I would say 80 to 90% of dentists do not actually have them mount their models onto mounts when they actually create the night guards. And that's a big problem. So, so it has to be done very, very well, and this way it actually can do the job that you want it to do.
Okay. Wow, I'm learning so much. All right, number 8, bad breath usually comes from the stomach.
So that's one of the sources. It comes from the tonsils, bacteria within the mouth. Many times I have patients with bacteria all over their gums, and that creates a huge amount of bad breath. So that's like probably the biggest source, I would say. People have stomach problems, acid reflux. Again, that has another issue. It has to do with acidity and erosion, bad breath, halitosis. Yes, it's one of them is a systemic problem when it comes from the stomach. One is tonsils. Another one is teeth. Another one is tongue. So those are definitely 4 areas that halitosis comes from. But there are ways of treating basically each one. But you have to first recognize the problem, and then sort of help the patient with that.
Got it. Gum disease can affect the body?
Absolutely.
And mouthwash is always good for you?
False.
Yeah, I know the answers now.
Exactly.
This is great. So now, what is one last message you want everyone listening to remember about their teeth, smile, and overall health? Just a final message.
This is a good question. It's hard for me to answer. Patients to understand about their teeth is, number one is know that your mouth is connected to your body, and it's not just one thing and one tooth. And many patients come to us and even say, I don't need an x-ray, you could just see what it looks like. No, I need to see what position your root is in sometimes, and you don't really know that has a lot to do with why the actual chip that you think is tiny and small and has nothing to do with anything needs to be seen, if that makes sense.
It does.
So everything is connected to something else, and I don't want to just look at one thing and say, okay, let's do that, because in an hour later you're going to have the same problem if I don't really know where the source of that problem happened. So really, like I said, don't go cheap on anything you do, because if you think that you're going to go cheap and get something that's good, there's usually like a saying, cheap, good, or time, fast. I think you can have 1 or 2 of them, but you can't have all of them. So really know that if you want somebody to take their time, and in medicine these days, physicians unfortunately have no choice, and they're taking less and less time with their patients. They're really, going in and out and really having less time for their patients, and it's happening in dentistry as well. People are insurance driven. You need to go to somebody who's really going to take their time and diagnose you properly. It's worth it. It's worth every penny. You need to do that. And when it comes to, Botox, derma fillers, same thing. Anything facial related, anything in your entire body. Don't go to somebody who's cheap, who's going to just, think that you're going to get something for nothing. You want somebody who knows what they're doing really, really well and is able to understand the next step and how this pertains to something else. We have a patient that has been going to an injector for many years, and she was looking the same, and she really didn't feel like it was doing much. She thought it was doing a little bit. And I said, listen, try this person, not because I'm stealing them away. I needed somebody to look at this in a different perspective, to understand it in a different way and try to see, if this made a difference. And she did, and she was thrilled. She is getting compliments all day long. So it makes a big difference of who and how they do things and how much knowledge they have when they do that. So when it comes to dentistry, it comes to medicine, it comes to physicians, integrative, biologic, holistic, general, everything. It's all important.
Got it. Well, thank you so much for making time.
Of course.
We're all done.
Yes,
I could
thank
keep
you so
asking
much.
more and more questions,
I
but
know.
thank you so, so much.
I hope some of it's useful.
Oh, thank you so much.
Yeah.
So you do
got
it
it.
in the morning, like a
I'm
little
so
bit
excited.
every day.
I love it.
And
Thank
then brush
you.
and rinse it out.
So it's very, very thin. The concept is not to, this toothpaste wasn't, I didn't design it to be like, oh, I want a good tasting toothpaste so that people could have an alternative to something else. This was made for the ingredients. The calcium phosphate, which is in your saliva, and it remineralizes your enamel regularly and naturally. Okay, so we have a form of something called ACP, amorphous calcium phosphate. So that remineralizes your enamel. Then you have the nanohydroxyapatite in a certain type and a certain percentage. Same thing with both of them. I wanted a higher percentage.
Cool.
And then this third thing was xylitol, which is actually kills the bacteria. Okay.
Wow.
So those are the things that I actually, those are the main ingredients, and then you have the coconut oil and the mint, but still, and some other emulsifiers.